Welcome back to the Mental Health Checkup. Today we're diving into something a little bit different, more scientific than usual, but still incredibly important to talk about. We're talking about psychedelics, specifically psilocybin, which is the active ingredient in what is commonly referred to as magic mushrooms. Now you've probably heard of it before, but what's really going on behind the scenes? Well, in this episode, we're exploring how this powerful psychedelic is currently being studied as a possible tool for treating mental health challenges like depression, anxiety, PTSD, and even addiction. We'll also talk about how exactly this works in the brain, the risks involved, public perception, and what the future might hold. Let's get right into it. Let's start at the beginning. What even is psilocybin? Think of psilocybin as a natural chemical found in certain types of mushrooms. These mushrooms have been around forever, used by indigenous cultures for healing, connection, and spiritual rituals for thousands of years. But here's the science part. When you eat a psilocybin mushroom, your body changes the psilocybin into another compound called psilocin. Psilocin is the compound responsible for the psychedelic effects people feel. It interacts with serotonin receptors in the brain, especially one called the 5-HT2A receptor, which plays a key role in mood, perception, and cognition. If serotonin is your brain's mood balancing chemical, then these receptors, especially one called the 5-HT2A receptor, are like little gateways that control how you interpret the world around you. And when psilocin activates these receptors, it can change how different parts of your brain communicate with each other. One area researchers are especially interested in is something called the default mode network, or DMN for short. This part of the brain is active when we're daydreaming, self-reflecting, or maybe even stuck in repetitive thoughts, like the kind that show up in depression or anxiety. Psilocybin seems to quiet down the DMN, which may explain why some people experience a sense of freedom from their usual thought patterns and feel more open or connected. It's like lifting a filter that normally shapes how we see ourselves and the world around us. And if the dose is high enough, the experience can be truly profound. You might feel like you're soaring through your own mind, like the secrets of the universe are suddenly within reach. But 5 seconds later, the entire experience could collapse into fear, confusion, or what's commonly called a bad trip. For some people, that fear becomes so intense that they generally feel like they're going to die. An emotional freefall that underscores just how disorienting and overwhelming a trip can become when things take a turn. Time itself may begin to stretch or collapse, minutes might feel like hours, or entire hours might pass in the blink of an eye. The thing about these trips is that they're not predictable, and that's what makes it so powerful and so risky at the same time. Now, a trip isn't just visual effects or hallucinations. It can be a deep psychological experience. And that experience doesn't just end when the effects wear off. In psychedelic therapy, what happens after the trip, known as integration, is just as important as the trip itself. Integration means taking time to reflect on what came up during the session, often with the help of a therapist or a guide. In clinical settings, this process usually begins within the session itself. Patients often lie down, wear eye shades, and listen to carefully curated music through headphones to help them go inward. Afterwards, integration may include journaling, therapeutic conversations, and revisiting insights in the days and weeks that follow. It's about making sense of what happened not just during the trip, but in the emotions and realizations that surfaced along the way. The goal is to connect those moments of clarity or emotional breakthroughs to real-life challenges. Without this step, the experiences can feel disjointed or even overwhelming. But with proper support, integration helps turn the trips into something meaningful and healing. Some people even describe feeling connected to the universe or gaining a sudden clarity about their lives, while others say they felt like they were standing at the edge of reality itself or experiencing a kind of universal empathy that made them feel deeply attuned to all living beings. Others might feel like they're reliving old memories or confronting personal issues they've buried. A trip can be beautiful and eye-opening, but it can also be really challenging. That's why therapists often encourage a specific mindset going in. Trust, let go, and be open. Trust the process, trust yourself, and let go of any expectations about what the experiences should be, and be open to whatever comes up. This kind of attitude can make a huge difference in how the trip unfolds and how deeply it supports healing. It really depends on two key things: your set and your setting. Set is your mindset, so how you're feeling emotionally and mentally before taking psilocybin. The setting is your physical environment, so where you are, who you're with, and what's happening around you. A calm, safe environment with people who you trust make it so much more likely that you have a positive and meaningful experience. On the flip side, however, a chaotic or uncomfortable setting can increase the chance of having a difficult or scary trip. Altogether, trips can last around 4 to 6 hours, though some after effects might linger longer. With all that being said, what's the legality of taking psilocybin? Well, psilocybin is currently considered a Schedule 1 drug in the US. That's the strictest category alongside drugs like heroin, which means it's seen as having no medical use and a high potential for abuse. But here's the twist. Scientists and doctors are currently pushing back on the label. The FDA have even given psilocybin-assisted therapy something called breakthrough therapy status. This is like giving a green light for fast-tracked research because early studies are actually showing it could actually help people with depression better than current medications. So while it's still illegal at the federal level, researchers are being allowed to study it more freely and things are starting to shift. Now that we've unpacked what psilocybin really is and how it works in the brain, let's talk about why it's getting so much attention, which is the potential to actually help people who are struggling with their mental health. Because at the core of all of the science and curiosity is one big question. Can this really be a tool for healing? Well, let's break down the ways psilocybin is actually being studied to treat some of the toughest challenges in mental health: depression, anxiety, PTSD, and addiction. Well, let's start with depression first because it's one of the most studied areas when it comes to psilocybin. And here's the thing, depression is not just feeling sad, it's a serious mental health condition that can affect every part of someone's life. For people with clinical depression, even simple tasks like getting out of bed, brushing their teeth, or making a phone call can feel nearly impossible. They might lose interest in the things that they used to enjoy, feel hopeless about the future, or even experience deep emotional numbness. Now, a lot of people with depression are prescribed antidepressants, especially a type called SSRIs, or selective serotonin reuptake inhibitors. These are medications that help balance serotonin levels in the brain, which can improve mood over time. But here's the catch. They don't work for everyone. Some people wait weeks for any change, and for others, they don't help much at all. This is exactly where psilocybin comes in. Researchers have been looking to whether a single dose of psilocybin, paired with therapy, could help people with depression feel better, faster, and more deeply. And the results so far? Well, honestly, they're kind of mind-blowing. In one 2023 study with over 200 participants, people who received just one dose of psilocybin experienced significant relief from their depression symptoms. And that relief, it didn't just fade away after a day or two. It lasted weeks, or in some cases even months. Another study found that people started feeling better as soon as 8 days after those sessions. That's much faster than traditional antidepressants, which can take several weeks to kick in. Scientists believe that psilocybin might work by helping the brain reset, sort of like rebooting a computer that's frozen. This is because psilocybin actually promotes what's known as neuroplasticity, which is literally the rewiring of our neurons. And depression often traps people in these rigid thought patterns, like repeating the same negative thoughts over and over and over again. Psilocybin appears to disrupt those patterns, opening up new ways of thinking, feeling, and processing emotions. But now remember, these results aren't just from people taking mushrooms on their own in their backyard. These are carefully controlled sessions led by trained professionals in safe and supportive environments. That's a big part of why these outcomes have been so positive. It's not about escaping reality, it's about helping the brain heal in a way. Next, let's talk about anxiety, and not just the kind you get before a big test or some presentation. We're talking about deep, life-altering anxiety. One of the most studied uses of psilocybin for anxiety has been with people who are currently facing terminal illnesses, like advanced stages of cancer. Imagine what it's like being told you have limited time left. It's terrifying, it's overwhelming. And it's not just fear, it's existential anxiety, the kind that makes people question everything about their lives, their relationships, and what comes next. In recent studies, patients in these situations were given psilocybin in a controlled therapeutic setting. What happened was pretty incredible. Many of them reported a dramatic reduction in anxiety, not because the situation changed, but because their perspective on it did. People described feeling more at peace, less fearful of death, and even more connected to what really matters in their lives. Some people even said it helped them reconnect with loved ones or let go of long-held regrets. Experiences so powerful that many described them as the most meaningful experience of their lives. It wasn't about numbing the fear, it was about transforming it. What's so powerful here is that psilocybin didn't just dull emotions like a sedative might. Instead, it helped patients face their feelings head on and come out on the other side with a sense of clarity and acceptance. And the benefits weren't just temporary. In many cases, that shift in perspective, it persisted for many months or even years. But this kind of anxiety isn't just found at the end of life. A lot of people deal with intense anxiety every day, whether it's generalized anxiety disorder, social anxiety, or obsessive compulsive disorder, or OCD. These conditions can be incredibly tough to manage and often don't respond well to standard treatments. That's why researchers are now expanding their studies to see if psilocybin could actually help here too. While the research is still early, the signs are pretty promising. People in these newer trials are reporting that psilocybin actually helps them step outside of their usual patterns of fear and worry, patterns that can feel very impossible to break. It gives them the space to breathe, reflect, and approach their anxiety in a very new way. While we need more data to know exactly how effective it is for these broader types of anxiety, what we've seen so far suggests actually that psilocybin could be a very big game changer for people who feel stuck in these constant fears or mental loops they can't escape. Now let's move on to PTSD, or post-traumatic stress disorder. PTSD is a serious mental health condition that happens after someone experiences a deeply traumatic or life-threatening event, such as combat, assault, a serious accident, or even a natural disaster. People with PTSD often feel stuck in this survival mode. They might have flashbacks that feel as real as the original event itself, nightmares that keep them awake at night, or feel completely numb and disconnected from the world around them. Everyday life can feel like a minefield where something as small as sound or a smell brings back the trauma. Traditionally, PTSD has been incredibly difficult to treat. While therapy and medications can help some people, others don't respond well to the standard treatments or they just find it too painful to talk about their trauma. That's why scientists are beginning to explore new options. And one of those options, well, it's psilocybin. And here's why that's exciting. Psilocybin appears to help people revisit traumatic memories in a way that feels safer and more manageable. Instead of being overwhelmed by fear, individuals report being able to face what happened with a new sense of openness and reflections. In a therapeutic setting, that can be incredibly powerful. When someone with PTSD is finally able to process what they've been going through or avoiding for years without being consumed by panic, it can be the beginning of a real healing. So far, MDMA, which is another psychedelic, has taken the lead in PTSD research, but psilocybin is catching up. Clinical trials are currently underway, particularly with veterans, who often face some of the most severe forms of PTSD. These studies are still in the early stages, but initial findings suggest that psilocybin might be actually able to reduce symptoms like anxiety, depression, and emotional numbness, all of which are common in PTSD. And since psilocybin has already shown promise in treating depression and anxiety, both of which often co-occur with PTSD, it gives researchers a compelling reason to explore whether the same therapeutic effects might also help those living with trauma. These overlapping symptoms suggest that if psilocybin can help regulate mood and reduce fear-based thought patterns, it could play a huge role in PTSD treatment as well. While we're still learning how exactly psilocybin can actually help people with PTSD, the early results are pretty promising. And if future studies continue to show positive outcomes, psilocybin could actually become a much needed tool for people who've been living with this trauma for far too long. Now, before we move on, let's take a moment to think about something that might seem a little unexpected. When you hear the word drug, your first thought probably isn't healing. It might be danger, risk, or even addiction itself. But what if the very thing we've long labeled as dangerous could actually help people overcome one of the hardest battles anyone can face? That brings us to our next topic, addiction. Now I know, using a psychedelic to treat addiction might sound totally backwards, but once you understand how psilocybin works and what the research is actually showing us, it actually makes a lot of sense. Addiction isn't just a physical craving. It also is deeply tied to emotional pain, trauma, isolation, and mental patterns that people feel trapped inside. Whether it's alcohol, nicotine, or opioids, the cycle of addiction often comes from trying to escape something very difficult, something unresolved. And that's where psilocybin might come in. Researchers believe that psilocybin can actually help people confront their emotional roots of their addiction in a safe and insightful way. During a guided session, people often report gaining new perspectives on their lives and behaviors, almost like they're stepping outside of themselves to see things more clearly. That shift in mindset can be exactly what's needed to break the pattern. Take a 2022 study, for example. It focused on people struggling with alcohol dependence. Participants who received 2 psilocybin sessions combined with psychotherapy reduced their drinking dramatically, and those changes they didn't just last a few days. Over time, the psilocybin group had significantly fewer heavy drinking days compared to the group that didn't get the treatment. And it's not just alcohol. In a separate study on smoking, over 80% of participants quit smoking after their psilocybin sessions and stayed smoke-free for at least 6 months. That's an astonishing success rate, especially when you compare it to traditional methods like nicotine patches or gum, which typically have far lower success rates. But what about other types of addictions? Well, scientists are actually expanding the research right now into even harder to treat addictions like opioids and cocaine. And while those studies are still ongoing, the hope is that psilocybin can actually help people unlock the kind of emotional insights and motivations that traditional treatments sometimes can't reach. It's still early and it's definitely not a one-size-fits-all solution. There's also another approach that's getting a lot of attention right now. It's called microdosing. This means taking very small, subperceptual amounts of psilocybin, not enough to cause a full psychedelic trip, but just enough that some people report subtle boosts in mood, focus, or creativity. While microdosing isn't as well studied as full-dose therapy, it's gaining popularity, especially because people find it appealing as a gentler, more manageable way to explore the potential benefits without committing to a full psychedelic experience. Now, scientists are still trying to figure out exactly how and if it even works, but it's an area being explored more and more as the conversation around psychedelics grows. But for people who feel stuck in this cycle of addiction, especially those who haven't been helped by other methods, psilocybin could actually represent a new, meaningful path towards healing and change. Okay, up to this point, everything we've explored about psilocybin might sound incredibly promising, almost too good to be true. The rapid relief from depression, breakthroughs in anxiety, potential for treating PTSD and even addiction. It's enough to make you wonder, well, is there a catch? And as with anything powerful, of course there are risks, and it's just as important to talk about those with honesty. This is a part of the conversation that often gets overlooked, but it's absolutely essential to understand. Now, one of the most talked about risks with psilocybin is something called a bad trip. Now, that might just sound like an uncomfortable or weird experience, but in reality, it can be way more intense. While not everyone has a bad trip, surveys show that roughly 1 in 3 people actually report going through at least one. So it's not the norm, but it's also not rare, and that's why preparation and supervision are so important. A bad trip can feel like being emotionally overwhelmed, stuck in fear, or even losing your sense of reality. People often describe feeling trapped inside their own thoughts, experiencing extreme paranoia, or reliving difficult memories they weren't prepared to face. Physically, they might tremble, cry, or feel completely disoriented. And in a large survey of nearly 2,000 people who experienced a bad trip, over 60% of them said it was one of the most challenging experiences of their lives. That's huge. Some even said they behaved recklessly during the trip, putting themselves or even others in unsafe situations because they were so confused or scared. But here's the surprising twist. More than 80% of those same people later said that their bad trips actually ended up being meaningful. Not just something they survived, but something that actually helped them grow or understand themselves more deeply. That's the strange paradox of psychedelics. A difficult trip can sometimes lead to important breakthroughs. Still, let's be clear, this isn't something to experiment with lightly. A bad trip isn't just some bump in the road. It can feel like a mental roller coaster you didn't sign up for, and one that you actually can't get off until the effects wear off. Imagine someone who took psilocybin in a loud, chaotic environment, without any guidance or preparation. Within minutes, their thoughts start racing. They feel like everyone around them is staring. The walls seem to breathe. Their sense of time disappears. Soon they're caught in this loop of terrifying thoughts, like they'll never come back to normal, or that they've completely lost their control of their mind. Their heart starts racing. They begin to panic, and everything feels like it's collapsing in on itself. And that's exactly why experts constantly emphasize the importance of set and setting, your mindset going in, and the environment you're in. And even more importantly, why guided use in a controlled, supportive setting, like with a trained therapist, is so crucial. With the right support, the risk of serious harm from a bad trip drops dramatically. Without it, things can spiral very quickly. So while a bad trip isn't necessarily the end of the world, it's a clear reminder of just how powerful psilocybin can be. It's not just about having an intense experience, it's about stepping into a drastically altered state of mind that can shake up your entire sense of reality. That's why the importance of mindset, environment, and proper guidance cannot be overstated, especially because psychedelics are so sensitive to context. When used in a warm, welcoming setting, these experiences tend to produce more meaningful and therapeutic outcomes. When used with care, preparation, and support, psilocybin has the potential for deep healing. But without any of those things, well, it can quickly become overwhelming, confusing, or even cause severe harm. With that being said, what's truly striking is that despite how intense the mental experiences can be, psychedelics like psilocybin, well, they actually have a very little impact on the body. Your heart rate might go up a bit, maybe your blood pressure as well, but overall, the physiology effects are minor. One researcher put it perfectly. Compared to the intensity of the subjective effects, it's remarkable how little impact these substances have on our physiology. Of course, everything has its risks, but compared to most drug classes, psychedelics are considered remarkably safe when it comes to the physical side of things. But, and this is a big but, one of the most dangerous physical risks doesn't actually come from the psilocybin itself, but rather from misidentifying mushrooms in the wild. Some poisonous mushrooms, they look very similar to psilocybin mushrooms, and eating the wrong one can actually lead to very serious illnesses or even death. That's why foraging without deep knowledge or experience is never recommended. Even one mistake can be life-threatening. That's why clinical trials and future therapies always use lab-tested, purified psilocybin, not mushrooms from the forest floor. It's a reminder that just because something is natural doesn't always mean it's safe if it's not handled responsibly. Even though psilocybin actually seems to be remarkably safe to our physical health, psychologically, psilocybin is not without its risks. And while most people may walk away from a guided session feeling transformed or even healed, others may have very different experiences. Let's break it down. For people who have certain pre-existing mental health conditions, like schizophrenia or bipolar 1 disorder, psilocybin can actually make symptoms even worse. These are conditions that already involve breaks from reality, and adding a more powerful psychedelic into the mix can actually lead to even more confusion, emotional instability, or full-blown psychosis. That's why researchers are extremely cautious and usually exclude individuals with these diagnoses from clinical trials. But apart from that, there are also less known risks as well. One example is something called HPPD, also known as hallucinogen persisting perception disorder. This is when visual distortion from a trip don't go away completely, even after the drug wears off. Think of trailing lights, moving patterns on walls, or even halos around objects. It's very rare, but it does happen, and it tends to show up more in people who use psychedelics frequently or without proper supervision. For someone already dealing with anxiety or OCD, these lingering effects could really be unsettling. So while the psychological risks aren't common, they're serious enough that they deserve real attention. This is a part of why the whole concept of set and setting is so emphasized in psychedelic therapy. The goal isn't just to protect the experience, it's to protect the person. And one of the ways that this happens is through something therapists call revealed truths or da moments. Insights that feel so deeply true, they hit not just in the mind, but in the heart. These are kind of realizations that can change how someone sees their life, their pain, or their purpose in life. Because when used carelessly, even something with a lot of potential can be very destabilizing. Now that we've established that there are indeed some psychological and physical risks involved with taking psilocybin, what about a combination of both? What about addiction? Classical substances like opioids, nicotine, or alcohol, they make the brain develop a chemical craving and physical withdrawal symptoms. These symptoms can be so severe that people feel they need the drug just to function for their life, and can even lead to death in certain cases, which reinforces the cycle of dependence. So with all of that in mind, here's something that's kind of surprising. Psilocybin is actually considered non-addictive. That means people don't develop this compulsive urge to keep taking it. In fact, if you try to take psilocybin again, within just a few days of a previous dose, your body builds a tolerance so quickly that it won't really have much of an effect. And here's another key point that really sets psilocybin apart. There's no classical withdrawals. With substances like alcohol, opioids, or nicotine, stopping the intake of the drug can lead to a flood of physical symptoms like shaking, headaches, mood crashes, intensive cravings, or even dangerous medical complications, and in very rare cases, death. These are signs that your body has come to depend on the substances just to feel okay. Psilocybin doesn't work like that. Unlike addictive substances, you don't wake up the next morning feeling sick, restless, or desperate for another dose. There's no physical crash or this intensive craving pushing you to take more. Instead, its effects tend to fade gradually and gently, without triggering the kind of withdrawal spiral seen in drugs like opioids or nicotine. This built-in resistance and tolerance that I was talking about before makes frequent or compulsive use much less likely. And that's one reason why researchers distinguish psilocybin from addictive substances. It doesn't hijack the brain's reward system or lead to compulsive use. Instead, when used intentionally, it encourages people to slow down, reflect, and process things in a much deeper way, which makes its therapeutic profile stand out so much more, because it's not about escape. It's about understanding, and from a therapeutic perspective, that opens up some powerful possibilities. That said, just because psilocybin isn't addictive in the traditional sense doesn't mean it's completely risk-free. Someone could still misuse it, especially if they approach it without proper understanding, or treat it casually like it's just another way to escape. Imagine someone's trying to self-medicate without guidance, using it over and over again to chase a breakthrough or avoid emotions without taking time to reflect or recover. Over time, even something with healing potential can become very disorienting, especially when the line between exploration and avoidance gets blurred. Think of it this way, the danger isn't that psilocybin pulls you in like a classical addictive drug. It's that it opens a door that not everyone is ready to walk through. Even tools meant for healing can become very harmful if they're used without intention, guidance, or respect. It's not about fear, it's about responsibility. So while psilocybin itself doesn't create addiction in the traditional sense, it does demand responsibility. It's not something to turn recklessly or as an escape for everyday problems. Used intentionally, it can be transformative. Used irresponsibly, it can be confusing, destabilizing, and even very dangerous. Like any powerful tool, it's all about how it's used and who's helping guide the process. So after hearing how psilocybin might support people with depression, anxiety, PTSD, and even addiction, you might be wondering, well, what's next? And beyond these conditions, researchers are actually starting to explore whether psilocybin could be helpful for other mental health challenges, like eating disorders or end-of-life distress in people who don't have cancer. These broader applications show just how much potential this therapy might hold. So what's next? If these studies continue showing strong results, we could be looking at a future where psilocybin isn't just something studied in labs or whispered about in alternate circles. It could become an actual approved part of mental health treatment. If that happens, the FDA might approve psilocybin therapy for depression or other conditions in just a few years. And that would be a massive shift, not just in medicine, but in how we think of healing itself. It would also mean the DEA would likely have to reclassify psilocybin, opening up the door for wider medical use. States and cities will probably keep experimenting with local laws, and more clinics will start to appear, staffed by trained therapists who specialize in psychedelic therapy. Experts are also discussing how to exactly train these professionals, how to make the therapy affordable, and how to make sure it's done safely. So to wrap it up, psilocybin isn't magic, but it might be medicine. For people who haven't found relief through traditional therapy or medications, it offers a new path. That being said, it's still a very powerful psychedelic substance, and while the research so far looks incredibly promising, we're still in the very early stages. Scientists are learning more with every study, but there's still a lot we don't fully understand, so it's not something to take lightly. And like any powerful tool, psilocybin demands care, respect, and preparation. It's not a quick fix, and it's certainly not a cure-all. But in the right context, with trained guidance and the right support, it could become a transformative piece of the mental health puzzle. The future of mental health treatment might look very different than it does today, and if we move forward thoughtfully, psilocybin could be a part of that change. Alright, that's a wrap for today's episode. I know this was a lot, but I hope it really painted a clear picture of what psilocybin is, how it works, and what it might be able to do, and what we still need to learn. If this episode sparked your curiosity, share it with someone who might find it interesting. And as always, thank you for tuning in to the Mental Health Checkup. I'll talk to you soon.